Hello, my name is Dr. Susan Jenkins, and this training is jointly developed and provided by Evidence Oracle and the Open University of Tanzania's voluntary organization for professional monitoring and evaluation. Evidence Oracle is a consortium of experienced evaluation data science professionals who provide support to organizations and government agencies in building sound evidence for organizational success. We offer trainings as well as logic model, performance management, and strategic planning support. The Open University of Tanzania's voluntary network for professional monitoring and evaluation is a collaborative professional network dedicated to uniting individuals engaged in monitoring and evaluation. It enhances the profession by fostering collaboration, facilitating knowledge sharing, and advocating for the critical role of monitoring and evaluation in policy and decision-making processes. It offers a platform for professionals to engage in best practices, engage in meaningful discussions, and build capacity within the field of monitoring and evaluation. It ensures accountability, sustainability, and transparency in development projects across Tanzania, as well as in other places. My name, as I said, is Dr. Susan Jenkins, and I will be your trainer for this session. In addition to being a senior director and founder of Evidence Oracle, I'm a senior fellow with the Data Foundation, a Washington, D.C. based nonprofit, nonpartisan organization. The Data Foundation is a trusted authority on the use of open, accessible data to fuel more efficient and effective and accountable government, spark innovation, and provide insights to the country's most pressing challenges. We conduct research, facilitate collaborative thought leadership, and promote advocacy programs that advance practical policies for the creation and use of accessible, trustworthy data and evidence. I'm also faculty at American University, also in Washington, D.C., teaching a course on program monitoring and evaluation. And today I will share with you my more than 30 years of program evaluation, data science, and performance management experience, which has been shaped through work with public and private profit and nonprofit organizations, both domestically within the United States, as well as on several international projects. I will also be sharing what I've learned during my tenure as the Chief Evaluation Officer for the U.S. Department of Health and Human Services. So with that, let's get started. This training, planning for evaluation of a program, project, or policy, designing evaluations that deliver real insights, is the first in a three-part series. This training will give you the tools to plan evaluations that are purposeful, effective, and aligned with broader goals like the Tanzania Vision 2050 and beyond. The second training, Beyond the Basics, Measuring Organizational Change That Matters, will prepare you to recognize outcomes commonly associated with organizational change initiatives, to develop a Z model to map change processes and outcomes, and to identify and measure system-level changes using appropriate indicators and methods. The third training in the series, titled Learn to Draw and Use Logic Models with Confidence, will teach you how to build and explain logic models, build logic models using a step-by-step process, and use them to engage stakeholders and to measure outcomes of programs and policies. For now, let's jump into today's topic, planning for evaluating a program, project, or policy. In terms of our agenda, we will focus on what is evaluation and how it differs from other types of evidence, practical information about the steps of an evaluation and what that means for cost and other resources, discuss considerations regarding planning for and using data. My philosophy is always to collect only what you need, but to collect it as well as possible. And a light touch on considerations for getting the results and findings that you develop used by decision makers. The learning objectives for today are how to assess readiness for evaluation, how to draft strong evaluation plans, how to choose the right data, and how to report findings that drive action. The purpose of evaluation is not to have a large report, but really to improve programs, policies, and enrich people's lives. What is the purpose of evaluation? All of us gather evaluative information and make evaluative choices every day. We think about which route to take to work, which meals to prepare, should we exercise today, which school courses to choose. And the common sense we bring to those decisions guides our behaviors, and it strongly resembles the scientific principles that underlie program evaluation. So think a little bit as we go through this training about what you collect most frequently as an evaluator. Generally, we collect counts of the people served by a program or affected by a policy, the satisfaction of those people served, changes in their knowledge or awareness of the topic that we're focused on, be it an educational project, a health project, or any other type of project, and changes in behavior of those people for improving. So eating more healthy diet or being better trained for employment. So changes in how they behave is also something that we measure. And so who decides what those evaluation questions will be? When we think about evaluation, it is systematic. It involves planning, testing, literature review so you can know what came before, and it's a systematic analysis. So it's not what people that are convenient to talk to think about a program. It's not what the founder of a program or the author of a policy thinks it should mean, but it's a systematic analysis of that. Evaluation focuses on the how and why of a program, a policy, or a project. Why was it or why was it not successful? Where performance measures focus on program or policy achievements over time, they don't offer insight into whether the program or policy caused those changes or results. Think about a sporting event. The score at the end of the event tells you who won and lost. That's more of a performance measure, but not what factors led to that win or loss. That's where evaluation comes in the systematic analysis. There are multiple types of evaluation life cycles, and different people resonate with different of these. So use the one that works best for you. I'll walk through the 3 different evaluation life cycles that are very common, but again, use the one that works best for you. I'm sharing them with you, and they are similar, but different people have different preferences, and they will resonate differently with you. So use the one that you like best. The main highlights for this one is the emphasis on cultural responsiveness in each step and the focus on including representation from all major interest holders in each step. Think about a poverty reduction program, something that is the focus of Tanzania Development Project 2050. The right questions from the program manager's perspective may focus on who are we providing quality services to? Are we reaching the people that need those services? But from the people receiving the services, the right questions might be related to being treated with respect and the convenience of the services. For example, are they offered at times and in places that recipients can access them? The government may have an interest in whether the programs are reducing homelessness, increasing enrollment of youth in school because parents are able to pay their school fees. And so engaging people throughout the whole process is very important, and it turns back to the idea of culturally responsive evaluation, bringing in all of the relevant interest holders in the evaluation process across the entire life cycle. Another model, which has the same basic steps, but more clearly emphasizes professional evaluation standards, which you see in the center of the circle, and ongoing inclusion and action in the out or ring of the circle. And so you have the same steps, but this model focuses on the standards of relevance and utility, rigor, independence and objectivity, transparency, and ethics. The third model is the most simple and direct, and that might be useful for you if you're working with people who are unfamiliar with evaluation and you want to give them a broad sense of its purpose and to help to get their buy-in. It's the PDCA cycle, which many people are familiar with project development, planning for the evaluation, doing the evaluation, checking the results, and then acting upon the evaluation. So these 3 models, these 3 life cycles can be helpful as you think about your evaluation journey. A tool that you can use, and I'll share other resources related to the tools that are mentioned today, this helps you to structure a conversation to understand the unspoken assumptions or theories about a program, a project, or policy, and the people or organizations that they affect. For example, if you implement a poverty reduction program such as Tanzania's Productive Social Safety Net, which provides cash transfers to vulnerable households and involves community participation, there may be assumptions among the program developer or managers about how large the cash transfers should be, how often they should be made, and how they should be made. This exercise will help to understand whether those assumptions are relevant. For example, if a program is based on the assumption that debit or cash cards that can be reloaded with money as needed is the best approach, this could be checked by using cash cards on a limited basis to see if they work as intended for the program, and also asking recipients how they prefer to receive their funds. If through testing and asking, we find out that some recipients live in areas with electricity blackouts, meaning that the cards cannot be used at all times, or people are making purchases outside of formal stores or businesses, cash cards may not meet their needs, and other methods, such as through cellular networks using phones, may be better. This information will help us to understand that if families are not using the cash cards, it may not be because they do not want to or that they couldn't benefit from the cash transfers, but rather that there are infrastructure barriers to their use. So, breaking down the assumptions of a program and checking them before we conduct the evaluation is extremely important. Let's think now about readiness for evaluation and focus on interest holders or stakeholders. And so think about who are you most likely to include as part of your evaluations? What issues and concerns of stakeholders should inform the evaluation questions, and understand the needs of stakeholders to help them focus the evaluation or other evidence building that you'll be conducting. So think about all of the different organizations that affect the program or policy or are affected by the program or policy. They don't all share the same investment. What recipients of, for example, the cash transfer program are most interested in might be the reliability of receiving those transfers and being able to plan for the future, where the government, another interest holder, may be more interested, as I mentioned earlier, in reducing homelessness or increasing school enrollment because parents can now pay for school fees. And so think about all of your interest holders and what it is that they want to know and need to know, and then balance them in your evaluation design appropriately. Again, think about your interest holders' needs in a very systematic way. And so determine what they want to know. What are issues and concerns that stakeholders have that should inform the evaluation questions? If they aren't finding from the evaluation what they need to know, they're less likely to participate. Understand the needs of stakeholders to help them focus the evaluation or other evidence building. Brainstorm a list of stakeholders. Categorize and prioritize that list because you can't do everything for everyone. And some stakeholders, possibly the funders of a program, will be the most important if they are also the funder of the evaluation when you think about what their needs are for the evaluation. Ask stakeholders always how to best engage them. Do they want regular meetings? Do they want written summaries and updates? What is it that they want to know, and how can you engage them in the evaluation? And examine the information from the discussions with the stakeholders or interest holders to refine your logic model, identify evaluation questions, and look for common themes that can help you to design a strong evaluation, the results of which will be used by interest holders. Next, we're going to talk about evaluation plans and what is the basic information that you need to use as you're planning for your evaluation. Think about a program to provide meals to older adults. I was involved in such a program in the Administration for Community Living in the United States. The goals were to provide nutritional meals and social interaction to help recipients stay in the community rather than going to a care facility, a nursing home, for example. And it's important to understand that if the meals are meeting the food and nutrition needs of people that receive them, that was part of the goal of the program. And we will want to know if the meals are provided as intended. Are hot meals hot? Are cold food cold? Are they suited to the different dietary needs of older adults who are in the target population? And do they account for the types of chronic conditions or religious beliefs that recipients have that may restrict their diets? What is the theory behind the program? Is there research or credible experience that shows that providing meals can help people to stay in their homes? Is this service already being offered? Or if the program delivers meals to the homes of people who are not homebound, but this then keeps them from getting meals at a community center that also has social activities or other supports. That may be at cross purposes with the goals of the community center program of both feeding people and getting them more involved in the community and linking them to needed social services and providing needed social outlets. It's important to document how a program, project, or policy is implemented in order to determine which aspects are central to its success and mission, and which are nice to have or context specific but not needed, because you'll want to focus your evaluation on those central, most critical elements. For example, a meals program must provide well-rounded meals that meet nutrition needs, but the specific foods could vary by community availability and preference. So an important outcome of the evaluation work then could be identifying that to be successful, a new meals program should include a meals preference assessment in the new location rather than adopting the same menu that a different site may use. Finally, it is also important to find out how those served feel about the meals program. If they don't like the food or the location or the staff or how the food is delivered and served, they may not eat it and will not benefit from the program. So that's another important element to include in your evaluation planning and some of the basic information you should think about including in your evaluation. Another tool you can use is this matrix that helps you to develop your evaluation questions. It can help you as you work with stakeholders and interest holders to set the evaluation focus, and over time as you try to maintain that evaluation focus. Starting off in the left-hand column, what do you need to know? For the meals program, you need to know, are meals recipients more likely to stay in their homes and not go to a care facility because of this program? The next column, what data exists or do you need to collect? For the case of the program, the meals program, you can split a sample of people at risk for going into a care home, give 50% of them the meals program, contact them over time to find out the length of time members of each group are in the community. How will you link, clean, and analyze the data to answer your questions? You can compare the average length of time in the community for those that receive the meals and those that do not. And then your last step is one evaluation cannot answer all questions, so you need to be honest with yourself and the interest holders about what the evaluation will not tell you. There may be other factors such as level of family support or an unexpected health crisis that we don't know about that causes people to move to a care facility. So think about what are the expected results of the work, but also think about what are the unexpected areas that might come up. And if you can think about those in advance, think about collecting data about family support or illness to help you to then interpret your results when you have them. And ultimately, what will you want to know? What decisions will you inform based on these data? What will you follow on with another evaluation or evidence building? What else might be needed based on this evaluation? And think about controlling for other factors related to meals helping people to remain in the community. So this tool, working through it from left to right, can help you to really identify a focus for and process for your evaluation. Next, we think about the researchable questions. What are the evaluation questions that we will be focused on in our evaluation? Evaluation questions should meet the information need that you've now identified using the previous spreadsheet. And they should be objective, fair, and politically neutral. They should not be leading questions. Evaluation questions are constructed so that the issues and concerns of a program's interest holders about the program can be articulated and can focus that evaluation. So think clearly about what the real information need is, how the information will be used and by whom. If you can determine the decisions that will be made as a result, you can craft better evaluation questions. So in the case of the meals program, rather than asking how much people like the meals, because that is not objective, fair, and politically neutral. Ask, what do people who receive the meals like and dislike about the program? So you're collecting both sides of the information. And if the goal is to determine who benefits most from the program, then you know you're going to want to ask questions about demographics of those individuals receiving the meals program and questions about the extent to which they are eating the food and the extent to which they believe that these meals are helping them to remain in the community, as well as then literally measuring the length of time that they are in the community. Thinking about researchable questions and focusing on the goals of the Tanzanian Development Project of 2050, there are a number of goals that refer to the same populations and similar outcomes. And any one program, policy, or project could therefore address multiple goals or multiple parts of goals. So being very clear with both how the program, project, or policy that you're evaluating fits in with the larger development goals of the Tanzania Development Vision of 2050, and what the concrete contributions and results of that program, project, or policy are. Referring back to the example of Tanzania's Productive Social Safety Net program, which provides cash transfers to vulnerable households and involves community participation, it could be considered relevant to the 2050 goals 1 through 4 of a diversified, resilient, inclusive upper middle income economy, an accelerated eradication of all forms of poverty with a focus on women, youth, and people with disabilities and regional development, high quality of life and well-being for all, and maximizing human capability by harnessing the potential of women and youth to drive development and engage as global citizens. But no one program can do all of these things, and no one evaluation can measure progress in each of these goals. But if we take two of the goals, we can develop researchable questions that can contribute to understanding progress towards them. So taking these two goals, the accelerated eradication of all forms of poverty and high quality of life, you see that several things are highlighted. We would be looking at focusing on all forms of poverty. So let's consider that the Productive Social Safety Net program provides cash transfers to women with children and people with disabilities and is connected to community centers or non-governmental organizations that provide classes and activities for these same women, their children, and people with disabilities. And maybe it's been rolled out on a limited number of geographic regions. In working with program leaders, we also find out that well-being and social cohesion are the focus for those offered programs. And so we will be focused on the highlighted elements here of poverty reduction for women, youth, and people with disabilities, focused on their well-being, as well as then social cohesion in the communities. Relevant researchable questions could be, what number and percentage of the women and people with disabilities that receive the cash transfers are above the poverty threshold and report reductions in late bill payments, utilities being shut off, or food insecurity? Are rates of school attendance better in regions where women and children are receiving cash transfers? Are people who receive the cash transfers more likely to participate in the classes and activities provided by the community centers and non-governmental organizations? And do people in regions with this program report better well-being? How does the reported well-being and social cohesion vary by percentage of a region participating in the program, the level of cash transfers, and the level of participation in the provided classes and activities? 3 ways to start evaluation questions are what, how, and to what extent. And try to avoid yes or no questions because you can't get rich research generally with yes or no questions. The condition might be the level of poverty. Does this program, project, or policy change the level of poverty for those served either before as compared to after, or as compared to a matched group of people who do not receive the cash transfers? The norm that you're setting might be a national or regional poverty rate. So a question might be, does this program, project, or policy help those under the poverty line to rise to at least the poverty line or to the average income for their community? When we think about program impact, the specific program impact could be on the outcome of interest, which is likely bigger than the condition or the norm in terms of better health, better quality of life, or improved quality of life for children and families receiving the cash transfers. So that's the larger impact. And based on what we know, possibly statistical models, what do we predict will be the results of the program, project, or policy in new communities, or if we make strategic changes in how it's operated? And so thinking about prospective estimates of what we think will happen based on this program. So those are some researchable questions in the area of descriptive questions, normative questions, program impact, and prospective investigation. Now let's think about assessment. And so examining the extent to which a project or program can be evaluated in a reliable and credible fashion. This is something that we need to do before we conduct an evaluation, because if a program doesn't have some sound, stable data, if the program is still in the process of being stood up and is not stable enough, or based on other factors, if it's not evaluable, starting an evaluation before it's time will not be a good use of resources. And so thinking about the assessment of whether a program is evaluable or not can help to prepare a program to put it in a place necessary to be evaluated, but doesn't replace good program design and monitoring functions. But always before starting an evaluation, think about the design of the evaluation and think about whether the program is actually evaluable and conduct this assessment. You will be thankful if you conduct this assessment before starting an evaluation that ultimately cannot be completed. So thinking about readiness for evaluation, think about what you've experienced or expect to be the biggest barrier to a successful evaluation. What are some of the biggest facilitators? For example, time. Do you have enough time for a credible evaluation? And has the program been operating in a stable manner for a significant amount of time, which then makes it more likely to be evaluable? Think about budget for the evaluation. Staffing. Is the program staffing and the evaluation staffing stable and sufficient? Is there an unclear evaluation purpose? If so, definitely clarify that evaluation purpose to make sure that you have a clear focus that you and the interest holders can agree upon. Look for whether the program is badly designed or well designed. What data does the program have? Does it have high quality data in the areas that you need? Does it have poor quality data? Look at resistance to findings. Are the interest holders, the funders, and the administrators going to be resistant to any findings and resistant to change? If so, the program may not be ready for evaluation. Think about their willingness or unwillingness to accept negative findings if you find some. Most programs are not perfect, so there will be some negative findings. And think about whether those will be accepted by leadership and how to make those acceptable, not by changing the data or the findings, but by couching them and offering context around them. And think about the difficulty measuring outcomes. Can you follow up with people receiving the cash transfers? In the case of the cash transfer program, can you follow up with people receiving the meals to determine how long they've stayed in the community? These things will affect the difficulty or ease with which you can measure your outcomes. So let's move on to a different topic. We have thought about our evaluation. We have thought about the questions. We've thought about our interest holders and stakeholders. We've thought about focusing our evaluation. So another question that comes up a lot is, how long will an evaluation take and who should I involve? So thinking about your evaluation plan, important factors to consider are the study goals. So talking with interest holders about the need for the evaluation and how the findings will be used will help to define the study goal, the evaluation goal. Think about the clarity of the program mission, goals, and theory. Through assessing evaluability, we'll looked through program documents and talked with people who know the program, the project, or the policy so that we now understand the mission and goals in theory as to why this program, policy, or project will make a difference. Look at availability of data. Through the evaluability assessment process, we will understand what data are already collected, how to access them and their quality, and whether they're useful for the evaluation. If a program collects no data or the data are very poor quality, a lot of missing data or confusion about how to collect the data, it's worth spending time to improve the data and help them to set up a sustainable performance measurement process and then later revisit conducting an evaluation. Think about the methods to be used. Once we think through the evaluation questions and the data that are available, we're more able to plan out our data collection and analysis methods. We can look at the data on income to determine poverty levels, and we can survey people about their well-being and community cohesion for the poverty reduction program. Then always think about budget. If we conduct a web-based survey, that would be less expensive than doing in-person surveys. Budget should not be the determining factor to shape our goals and methods, but realistically, we know that it needs to be considered. The key is to use the most rigorous methods feasible, and budget always impacts feasibility. And now the last point, involvement of program staff and interest holders. Evaluation needs to be collaborative to some extent, but you'll need to determine who will be involved and to what extent. Program staff and interest holders need to inform the study focus, but should not sway how the sample is selected, the sample of recipients. I was conducting an evaluation once where the program director gave me a list of the program sites to include as they were the best performing sites. This is inappropriate involvement because it would not allow for an objective evaluation. It would make the program look more positive than potentially it really was by only including in the evaluation the highest performing sites. So then we move on to what evaluation types we want to focus on. There are a lot of different evaluation methods and types, and so thinking about what type to include, that's what we're going to talk about now. So if based on our interaction and the evaluability assessment of a program, project, or policy, we're unsure about its fitness for evaluation, then a descriptive evaluation is a good option. A method of judging the worth of a program, policy, organization, or population without inferring causality or measuring effectiveness, because the program can't sustain that just yet. While not all descriptive studies are evaluations, some may be used for various evaluative purposes, such as to understand the relationships between program activities and participant outcomes and identify trends or patterns in data. So descriptive evaluations are one type that are suitable and appropriate for certain situations. Formative evaluations focus on understanding the program and documenting the program. In some cases, this may be all you need. For example, a fidelity evaluation focuses on how closely a program matches its ideal program, the guidance for the program, the manual for the program, the criteria for the program that have already been defined. For example, thinking back to the Productive Social Safety Net cash transfer program, if it's already been rigorously evaluated and there's strong evidence that when implemented as intended, it meets poverty reduction and well-being goals, when you implement it in a new community, a fidelity evaluation, which is a type of formative evaluation, may be all that you need. A way to think about this is to think about an example of a project that I was involved in evaluating with the U.S. Peace Corps. It was a clean water project. The goal was to reduce diarrheal disease and death, and science tells us that contaminated water is a significant cause of diarrheal disease and other illnesses, which then can lead to death. If people have access to and use clean water for drinking and cooking and washing, rates of diarrhea and related illnesses go down. This has been proven scientifically through rigorous study over time. Therefore, for the project evaluation, all we really needed to know was whether the water provided was clean and the extent to which people were using that water for their cooking, washing, and cleaning. We didn't need to reprove that clean water reduces diarrhea. Summative evaluations, which include impact and economic evaluations, are a type of evaluation that most of you will likely need to do. But keep in mind that assessing evaluation and conducting a formative evaluation to understand program input, activities, and outcomes are still very important for interpreting the findings of your summative evaluation. This is especially true if the program, project, or policy is not as effective as the interest holders has hoped. As an evaluator, you could then go back and look at the assessment of evaluability and the formative data to find out if there were issues with the data or implementation, and those could be the reason for disappointing results. Those can be addressed, and then a summative evaluation can continue. Also, when going back to issues of time and budget, if you conduct a good evaluability assessment and formative evaluation, you should also be able to address those implementation issues before you start your summative evaluation and avoid having to redo the summative evaluation. And this saves you both time and money and frustration. And frustration is extremely important because if you become frustrated with the program or the program interest holders become frustrated with you, that will negatively affect their participation in the evaluation and the quality of your evaluation results. It will also lead to higher costs in most cases if you're actually able then to complete an evaluation. Here's another tool that you can use, and it can help you to select the type of evaluation you need. So how you use this tool, you look at the questions on the left-hand side, and if you can answer yes to them, then you likely do not need the type of evaluation that's listed on the right-hand side. So looking at the question, do you know what the program is designed to do? If you answer yes, then a structured conceptualization is probably not an evaluation that you need. But moving down the list, do you know the overall effect, intended or unintended, of the program as a whole? If you answer no to this question, and that is something that you want to know the answer to, then an impact evaluation would be the type of evaluation that you should be planning. Another tool that you can use has to do with the roles and responsibilities of the different interest holders for the evaluation. And you can link this back to your original review of assumptions and your creation of the list of interest holders that you conducted as part of your early evaluation planning. So in this case, you look at the various types of interest holders. Those could be consumers in the first row, interest groups with significant subject matter interest in the second row, funders in the third row. And then you ask for each of those, what do they want to know the answers to, and why, and in what format do they want this information? And that can help you to plan what data you focus on and how you communicate with those stakeholders and interest holders and keep them involved, as we talked about when we looked at the life cycle of the evaluation slides at the start of this training. Another thing to think about are balancing measures, because for any evaluation, you can't equally value time, scope, and cost of your evaluation. The more time you spend, the more it will cost. The broader the scope, the more it will cost. So if you have limited time, you're going to need to limit your scope. If you have limited cost, limited funds, then you're going to need to think about how long the evaluation will be, and again, what the scope is going to be. So the more time and broader the scope, the higher the cost, for example. So ask yourself and your funder, which of these three has the most flexibility, and design your evaluation around that. So now moving back to the Tanzania Development Vision of 2050, one way to help to ensure that your evaluation findings will be used is to then link them back clearly and explicitly to a meaningful initiative, in this case, the Tanzania Development Vision for 2050. And so you can ask yourself if your evaluation of a poverty reduction program, the cash transfers we were talking about, can answer any of these questions. Where and in what population is poverty most common? What are the causes of poverty in these areas and populations? Which of these causes does your program address? Does it address jobs, skills, transportation, etc.? So these can be some of the questions and link them directly back to that goal number 2 of accelerated eradication of all forms of poverty with a focus on women, youth, and people with disabilities alongside balanced regional development. Linking it back to something that is important to your interest holders will increase the chance that they will use the results because you're telling them something central to what they need to know and what they focus on. Now you know what you're going to focus on. You've shown the importance of that focus and the evaluation to your interest holders. What data should you collect? And then what should you do with those data? The right data for your needs. You have your focus, your evaluation questions. You will need to plan for data about the participants or people affected by the policy, the services provided, cash transfers in the example we've been using, the results or outcomes of the service provided, and perceptions of the program. In your evaluation plan, you should be clear about the data and how they will be collected, analyzed, and reported. Some common decision points are, do you want to collect qualitative or quantitative data or both? Qualitative and quantitative, we need to think more about exploratory studies where you know less about the program. That's good for qualitative data. And if you need to know more about how it works, you may want to focus on that qualitative or textual data. Qualitative data are commonly more time-consuming and expensive than quantitative data, but if you don't know a lot about the program, and really this is exploratory, that is where you should start in most cases. You have to choose between primary and secondary data. From your assessment, you should have an idea if the data that you need already exist and if you can use them for your evaluation. This would be a secondary use of data as the data were collected for a different purpose and you're repurposing it for the evaluation. If the needed data do not exist, then you will need to collect them for the evaluation, and this is called primary data collection. Primary data collection also tends to be more time-consuming and expensive than secondary analysis, but it has the benefit of you're collecting exactly the data that you need and not trying to repurpose data that already exists that may not exactly measure what you need to know and answer your questions. Think about duplicated and unduplicated. Are the data that are available or that you will collect individualized? For example, I worked on a program that involved 6 different services that people could access. Many of the services did not require a sign up or sign in, so we didn't know the identities of the people served, and they could get some or all of the services at the same time. In this case, we could not know if the people counted for each service were different unduplicated individuals. And so this affected the analyses we could do and the conclusions that we could draw because we didn't know the services that any one person received. We just knew how many people received each of the different 6 services. Think about record level or aggregate data. In thinking about the productive social safety net cash transfer program, will you be able to get data for each recipient or will it be grouped or aggregated at the community level? And then think about unit of analysis. The unit of analysis may be something that you have control over and that is based on a theory or maybe based on the type of data that are available to you. For example, if you have a theory that cash transfers have a broad community effect, you may choose to analyze the data at the community level, and that would be your unit of analysis. If, on the other hand, you only have access to aggregate community level data, you may not have chosen it, but your analysis will still have to be at the community level. So thinking about these types of things can help you to determine the specific data that you need and how you will go about collecting those data and how you will be able to then analyze them down the road. Other considerations for selecting the right data for your needs. Common data sources are listed here. Administrative records. These are less expensive and time-consuming if the data meet your needs and are of high quality. This would lead you to secondary analysis of the administrative records of a program, and they may, for the poverty reduction program, include the number of families that are receiving the cash transfers, the amount of the cash transfers, and other things that are typically kept as records of the program to show that it is operating and that you can use for your evaluation. Surveys and questionnaires are more expensive, but you have more control over the quality of the data and its relevance to your evaluation questions. Focus groups and interviews are even more expensive, but very good for exploratory studies and for confirmation of quantitative analyses. Observation is only suitable for things that can be easily and objectively observed, such as whether people are accessing the clean water from the water project I described. But building time for training observers and developing observation and tracking forms needs to be considered. And then expert assessment. This is good for highly technical and complex program services and concepts where it's hard to measure. But if you have experts in those fields, they can provide an assessment as to the change and the outcomes of the program. As you think about the data you're going to use, also think about its relevance. Your earlier conversations with your interest holders about how they intend to use the evaluation results and what types of decisions will be based on those results can help you to answer these questions about relevance. But also use your professional training about data quality and evaluation standards in one of the earlier evaluation lifecycle models to support your decisions about which data sources to use. Will the data be sufficient to persuade a knowledgeable person that the findings are reasonable? And are they appropriate, meaning relevant, valid, and reliable? If your data do not meet these needs, then you need to rethink your data collection and your data focus. Reliability is also an important element as you think about what data you will collect and how you will use it. Always look at the quality of the data collection tools that you use. Tested tools are better. If available and relevant for the data you need, use those rather than developing new tools specifically for your project. If you have to develop a new tool for your evaluation, it's really worth it to take time to test that tool through piloting with people or organizations like the one that you will include in your evaluation. You can also use subject matter experts to review them and use trained methodologists to design them. There's a science to crafting survey questions and protocols for focus groups, for example. And so take advantage of professionals that can help you to do that so that your tools for your data collection are more likely to be reliable. Now let's think about the data validity. Internal validity asks, did the treatment, service, or program make the difference in this specific instance rather than other extraneous variables? External validity asks, what population settings, treatment variables, and measurement variables can this observed effect be generalized to? And as you think about reliability, can you trust the data collection tool? When you think about validity here, are you measuring the concepts or outcomes that you think that you are? And so internal validity is looking at under the best case scenario, is your program with everything else that's being controlled work as intended? And then external validity, can it work in the real world? Turning to data quality, think about measurement accuracy, the processes that you're using, causal claims. Can you say that this program, policy, or project caused the changes that you're seeing? Have you developed your data collection, your sampling, your comparison groups sufficiently to be able to make causal claims? Generalizability, are you trying to generalize to a larger population? Then you need a representative sample, for example. Thinking about statistical inference and multicultural validity, think about these things as you think about the quality of the data you collect or the quality of data that you're using for secondary analyses to help you to determine, are the data of high enough quality, accurate, allow for causal claims, generalizable, to be useful for your evaluation. As you think about the data, make sure you collect enough data, not just about the program itself, but about the context in which it operates and the people with whom it operates. And so here's a cartoon that I like because it always reminds me to collect the denominator. So look at my drawing. Wow, that's worth 3 stars. Well, is 3 stars good or is 3 stars bad? If it's 3 out of 3, it's great. But the little cat asks, 3 stars out of what? And the father points to billions of stars. So three by itself doesn't tell you anything. Within the context of 3 out of 3 versus 3 out of 1 billion, now you know something. And so going back to the productive social safety net cash transfer program, if you find out that 100 families are better off economically due to participating in that program, you're going to want to know, is that 100 families out of 125 families or out of 500 families? Further, if you find that, for example, 58% of people that receive cash transfers are more economically stable, you still need a matched comparison group to know if that was based on your program. Maybe a new business came to the community and all the people in the community are more economically stable regardless of whether they received the cash transfer or not. So you need to collect some contextual information as part of your evaluation. And so, what are the right data for your needs to measure contextual information? And so, how do you address issues of context? Test the validity of data collection methods with target populations. We've already talked about pilot testing a little bit. Consider the hypotheses from different perspectives as different explanations for your findings. Examine moderator effects. Does the person or organization that collect the data or results affect the response rates or other data-related aspects? If the government, for example, comes in to ask about the quality of a program, people may respond more positively about their perceptions of the program and the effects of the program because they're afraid that it will be taken away if they respond negatively. And then those data are not actually an accurate representation of their actual perception of the program. And then think about statistical procedures to examine cultural variables, such as comparing subgroups. Are people that live in town A different than people that live in town B? Are women of an older age having different results than women of a younger age? And so collecting and looking at those cultural variables and comparing subgroups is also very important for understanding the context in which your program, project, or policy is successful. A tool that you can use to help you think through some of this is to briefly describe the culture of an organization, of a community, of a program, and then how that might affect your evaluation and what you can do as part of your evaluation. And so thinking about that in advance as part of your planning can help you to avoid any problems based on those things. And now, as we wind up this about this training, the right data for your needs, think about policy making. And so create partnerships, work with policymakers who will be your users to know what they need to know and on what timeline. I was working on a 3-year evaluation when the funding for the program was suddenly cut off. If we had been better partners with the funders, we may have been able to revise our evaluation to provide at least something useful in the new time frame, or to postpone the funding cut till after the evaluation was complete. Those partnerships can help to make your evaluation possible and then to have the data when the policy makers need them for making their decisions, so they don't make them without your important evaluative information. Building trust. People are more likely to trust the quality of your evaluation work and your findings if they trust that you are knowledgeable, that you are an expert, and that you are using the best methods for the question at hand. Local and timely findings. People like data that are specifically relevant and do not require translation. A regional policymaker may not have time to interpret national data. They want to know what the results mean for them and what they should do in their region. So if you have data available at the regional level, or you can interpret it at the regional level, do so for your regional policymakers. And then actionable recommendations. Policymakers typically want you to connect the dots between the findings and what this means for specific policy implementation, for their activities, and for programmatic changes. They don't just want to know these are the findings. They want actionable recommendations that then they can choose to use or not to use, but at least it gives them that much more information for making their decisions. And then think about accessible formats. Know how the funders and the policymakers like to receive information. Do they like data visualizations? Do they like written reports? Do they like in-person briefings? Make things easy for policymakers to use the data and evidence that you're providing. And so the next question comes up, how do I report the findings to better ensure that they are used? And here's a chart that can be helpful, characteristics of research recommendations. And so this sums up many of the points made throughout this presentation. Provide actionable information, but clearly explained, and the high quality evidence that backs them up. Communicate with interest holders frequently and throughout the evaluation, design, implementation, and reporting phases, and confirm that the communication is going in two ways and is being understood. Just telling someone something doesn't mean that they absorb the information or that they understand the information. And so make sure that you're using active listening and that you are absorbing what you are hearing. And also communicate about the feasibility of answering questions that interest holders have to meet their needs, the feasibility of conducting a high quality evaluation within the cost, time, and scope limitations that they place on you, and that you have an understanding of the feasibility of implementing the recommendations to help ensure that they are in fact actionable. Because making recommendations for higher funding of a program, if there is no more funding available, is not an actionable recommendation in reality. It's not feasible. And so at this part of the training would be the time for questions and discussions. And please, you can contact me for more information at evidenceoracle@outlook.com. And please join me for the other two trainings in this series. We look very much forward to working with you.